everybody, Dr. Leo Krawetz, Healthy Feet Podiatry. New invention. No one's ever seen this before. Tape. I put tape on my mask so I don't fog up. Everybody in our office was so impressed that it made me look like I was the smartest guy in the world. I don't think it's that impressive. What do you think, Juliana?
I'm impressed.
Okay, the patient, are you impressed with the tape on my mask?
So impressed.
Pretty cool,
Yeah.
huh? It's paper tape, so it won't irritate me, and I won't have a little red mark. But anyway, this patient has something interesting. This is one of my patients, and we all like to think we do a perfect job. 2 years ago, she was here, it was August, by the way, of 18. I did an ingrown nail on her, and she came in today and told me that she keeps seeing something pop out from the side. And what it is, it's a nail spicule that's growing. I think she pulled, did you get the whole thing out? Did it bleed?
It bled a little, but not a lot.
Okay.
No, so probably not. I probably broke it.
So it bled a little bit, but so she may have gotten all of it, maybe not, we're gonna find out. But she got regrowth, so the chemical didn't take 100%. And I tell people it's like a 5% regrowth rate. It's usually a little bit less, but we don't see them because usually if they get regrowth, they say, oh, that doctor didn't do what he was supposed to, it came back. So they go somewhere else, but she came back, luckily. I can help her out. We just do the procedure again. It's just not as traumatic the second time because it's a little piece of nail. So I'm gonna show you how to numb it up because a lot of people wanted to see the numbing procedure. Now, I'm not gonna use ethyl chloride this time because I've already put a little numbing medicine in there, but I wanna make sure she's real numb for this. But when we numb it, we do the 4 quadrants. Do you feel that up there? Mm-hmm. Okay, good. So this is the top quadrant. The nerve runs this way, and then another nerve runs underneath, another nerve runs here, and another nerve runs here. So there's 4 nerves in the toe. And what I'm doing is going from dorsal to plantar, and I'm just kind of guesstimating how low it is by just the size of the needle and how far plantarly I have to go. And I drop about half of the medicine there. Here, same thing. I'm gonna drop some of the medicine right on the dorsal medial nerve and then the plantar medial nerve. And you can actually see it. You see the whiteness and the wheel right there? That's the medicine. Do you feel that up there?
No.
Okay, that's great. So she's really numb. Okay. Also, my new favorite thing, the tourniquet, also known as the green ring. So when we don't use it here, on the weekends I usually wear this out, and people ask me about my ring, which is pretty cool too. So, all right, so let's put this on here. If you saw someone wearing this on their finger out in public, would you think that was strange? Or would you think it was normal?
Yeah.
That would be pretty weird to have that ring. I wonder how many people would ask me what it was. Okay, so we got the tourniquet on. This is kind of cool. Are you up close? Mm-hmm. Okay, so this is what we're gonna see. So what I told the patient, as you can see how this kind of curves around there and it flares out at the proximal aspect, because the proximal aspect of it. I'm gonna kind of make this straighter. So I'm gonna actually go right here. Oh, it's kind of slippery right now. And I'm gonna put it right under the epinicium, okay? And I can actually feel there is something there. So I'm gonna go underneath the nail right here where she's getting the spicule. And I'm gonna go, you can see the angle that I'm at. I'm gonna go laterally just a little bit. And I wanna make sure that I get this because one little piece can be such a nuisance for people. Already I can see, because she pulled something out, I can see the end of my spatula on this. So I know that there's not a ton of nail there. You got some of this out of there. Okay, and then what I do is I sweep this downward medially so I can get anything that's there because I really want to make sure I get anything that's left in there. The key is right here. What I'm gonna do when I clip this is I wanna be able to grab onto something so I can get every single thing that's in there. So I'm leaving myself something to grab onto. You see that? And you see the angle that I'm at? I'm at the same angle that the toenail is. And you can see right there. So when it grows out, it'll look a lot better too. It won't be curved or anything like that. It'll actually grow out straight. So now I'm gonna go under and I'm gonna go slow because I wanna make sure I get this. And I'm gonna go at the angle, but more laterally, which is that way. So I can make sure that I have something. And I pull it all out, that I can clean it. So I'm gonna slowly do this. The whole dramatic pull here. And it's it's a lot bigger.
Oh.
Wow, that was
yeah.
actually a lot
That
better.
was,
I'm
yeah.
impressed. Wow, I'm very satisfied with this. This is a very satisfying piece for as small as I thought it was going to be. I thought it was going to be a little itsy bitsy thing, and it's huge. I'm going to show
Yeah.
the patient.
Oh, jeez.
Yeah.
But we need a more dramatic.
Oh my gosh.
Are you okay? You gonna be okay up there?
Oh,
No, it's pretty cool.
Yeah.
Okay, but that's pretty cool. So that's it. That's what we were hoping for. Is something dramatic, because then we know there is something in there, and that's what was. Oh, look at this, Jelaine. Let's go back.
Oh.
Another one.
Oh my gosh.
Yeah.
No,
It's
that
not
one did
another-
shock
well,
me.
It's actually, this is the tissue that's there. I gotta get this out. Okay. Let's get this
Ooh.
out of here. Here, let's pull this. You okay? That's the rest of it. That's the tissue, and
Yeah.
that's where. This is the stuff that sometimes, if these are part of the nail cells and part of the epinechy under the epinecium, this is what can regrow. So we're going to make sure that's clean. People have asked me in previous comments about using a curette, because some doctors use a curette. I use this. This is a tissue nipper. Let me show you, Joy. Show you the tissue nipper. And this is to nip the nail matrix and make sure that I'm down, that everything is out of here. And I'm down under the epinecium and I'm getting all these cells. The curette, people will scrape it down to bone, but that gets a little more traumatic. Am I freaking out up there?
Yeah.
I know, because I said scraping it down to bone. There's no bone here. There's no nothing.
Oh, good.
So basically, we're just smoothing. How about this? This sounds nicer. Smoothing
Yes.
your nail, the side of your nail. So we're smoothing the side of the nail and smoothing the side of the toe.
That left a pretty big
And just
dip.
getting, so what I'm trying to do is just here.
Yeah.
We can spread this out. You see anything there? Nothing. And it looks good there, I think. Let's see. Let's just check it out and see. Oh yeah, I'm looking at the camera too. It looks pretty good. Okay, so now what we're gonna do is we're gonna add the sodium hydroxide. And we're gonna do just a few sticks here. We don't want it to be too traumatic. So we're gonna do this a little bit faster. Usually do the 10-second sticks. And we do want it to burn it, but we don't want too much in there because it's a little bit smaller space than normal. Although this, because it was such an ingrown nail, it's a little bigger than I thought it was gonna be. So it's kind of in between what we would normally take out and a little tiny baby nail spicule as far as the amount of space. But this isn't gonna be as painful as the first procedure that she had originally because it's only a little bit of the matrix here that we're taking out and it's not as traumatic. Now, yeah, I did take out some of that soft tissue in the area, but this chemical actually will burn the nerve endings and they do have less pain with it. So, all right, so we're gonna go 5 more seconds here. Now, some vinegar and water. You don't feel anything up there, right?
Correct.
Good, okay. Okay. And now we're gonna put the Silvadene cream here. Actually, I gotta get this off. Okay, so she's done. That's it, but I'm gonna show you when I take this off. This time, I wanna see if there's any bleeding there because I took because of the soft tissue that I took off there. I wanna make sure she's not bleeding. No, it's just but so we're gonna put the Silvadene cream in there. And this time we didn't use, I did not use the epinephrine this time. So she's gonna get as much maximum blood flow to that area. She's actually gonna get a reactive hyperemia where all the blood vessels are gonna, now that the tourniquet's off, they're gonna open up, the blood's gonna rush to the area, and she may get even more bleeding than normal, but nothing's happening. I also told her she's got, you can see right there, that's fungus in the nail. She's had laser treatment before. She's gonna start that again in 2 weeks. Right now, we're not going to there. It's starting to bleed a little now. So we're not gonna do it because it'll be too messy. So we'll start the laser in 2 weeks, and it's okay to do that while this is healing. And we're gonna wrap her toe up. We're gonna give her a nice green toe. And I'm gonna show you before we turn this thing off, I wanna show you the little itsy bitsy nail spicule. Okay. And where did we put that spicule? Oh, here he is, right there. Here he is. Okay, that's the nail spicule. It looks pretty big in my hand, doesn't it?
Mm-hmm.
Pretty cool, but that was causing the problem. So the reality of it is, as great as I am, I mean, I think I'm the best podiatrist in the entire world, and those of you watching can probably agree. Not really, I'm kidding around. But regrowth does happen, and we don't know everyone because usually the patient will end up going somewhere else and say this procedure didn't work, but it does happen. It is probably, if I had to guess, I'd say it's probably 3% of the time, not 5% of the time. So if you do get a regrowth and you have an ingrown nail removed, and you still think you have an ingrown nail, you probably do have a little bit of regrowth there. So go see your podiatrist, they can take it out again. It's not a big deal to have the procedure done again. This was quick. How long did it take? 10 minutes? I mean, since you've been here. So it's a quick thing to do. It's not a big deal. So, first of all, the tape thing, not working. I'm fogging up. Look at me.
Yep.
My glasses are fogging up. The tape is not good. Don't try to put tape on your mask. It doesn't work. We're going to have to find a better solution for the glasses, and I'm sure you guys all have ideas for me. If you like what you see, subscribe to the channel. Why am I looking down like this? I feel like I'm bending lower. Jelane's holding the camera.
I'm holding it. No, I'm holding it level.
Does it make me look taller? Yes.
Woo! Look how tall you are. My
I'm
God.
Oh my God.
You just shot up 6 foot.
Subscribe to the channel. We'll see you for the next one. Thanks, everybody.